My topic of interest for my ISM mentorship is licensed professional counseling. I'd like to become a licensed professional counselor someday and help out children and young adults to be their best self, whether they are dealing with anxiety, depression, or other mental illnesses. There are times when I do not like to put myself out when what I am doing is not most popular. I am happiest when the people around me are happy, and I am a people pleaser, so I'll do anything to make sure that others are happy before myself. I want to pursue the career of a counseling psychologist because I care about the well-being of others, and I want to do that every day for people, whether I know them well or not. I love being around people, so being an LPC would be perfect for me. I chose this class to learn how to put myself out and not be afraid to make the first step to contact someone or talk to a complete stranger about my dream of becoming an LPC and how I could get into that position. I would love to be able to have an internship at a private practice or in a hospital alongside other counseling psychologists as well. Milton Berle once said, "If opportunity doesn't knock, build a door." Through this independent study and mentorship class, I hope to be able to build my door of opportunity up. Throughout the interviews and research assessments that I've had so far, I've only been able to think of positive things of this job field. I understand that I'm only on the tip of the iceberg of my research and journey in ISM, but I've started to look forward to becoming a counseling psychologist in the future even more. So my mission statement is to help patients become the best version of themselves possible through counseling, and to help provide therapy to patients with the highest quality programs as possible to help the patient become successful in daily life. And my quote, again, is, "If opportunity doesn't knock, build a door." And I said that through this quote, I took it as that I hope to build up knowledge of this topic, even if sometimes the research leads to some type of dead end. So what type of counseling I want to do is children and young adults, ages 8 to 17 years old. And I'd like to be with clients that are battling depression, anxiety disorders, and possible substance abuse, and other things like that. I got interested in licensed professional counseling because I heard about it from my uncle's wife, and she told me a little bit more about what the job has to do, and it sounded very suiting for me. So far I've interviewed 7 people, and I'm just going to tell y'all a little bit about what I learned from each interview. So with Elizabeth Beebe, I met with her on September 18th, and she owns her small private practice, and it's just a small company, and she makes her own hours, stuff like that. And her favorite part of it is talking to people, because she just likes to be able, she's a very social person, so she likes to be able to talk to people about what they're going through and help them and stuff. And then next I interviewed Christine Price the next day on September 19th, and she works for a small company alongside other counselors, and she brings her dog to some appointments to make clients feel more comfortable and at home. And I thought that was different because you don't usually hear about people bringing their dog to work with them. So it showed that this job can be more flexible also. I also interviewed Dr. Brad Schwall on September 22nd, and he owns a private practice where people work for him. And he mainly deals with the business side of the company, and that's his favorite part of it, which is mainly the insurance and contacting the payments and everything like that. So he likes that side of the company. And then on September 29th, I interviewed Matt McKinney, and he owns a small private practice called Journey On Counseling as well. And he works mainly with boys and young men, which is his specialty, but he also works with marriage counseling and stuff like that. And he's a Christian counselor. And then I met with Tara Wiedemeyer on October 1st, and she works under a psychiatrist. And a psychiatrist is mainly the science-y side of counseling, so they're the ones that will prescribe your medicine, and they like chemistry, that's their side of it, and Psychologists are more like talky. And then she likes the talking to people side, and she mainly works with teenage girls and couples. And then my last interview was on October 13th, and her name was Tiffany Ashenfelter, and she works alongside her husband. They both own this company together, and it's just Ashenfelter and Associates. And she works mainly with women while her husband works mainly with the men, and then they do marriage counseling together. So it's like a group counseling session, which is different than normal as well. So then my research assessments, the first one I did was, what is a licensed professional counselor? And basically it just explained what licensed professional counselors do. So they work more with people in lots of ranges, whether it be just if they're having a hard time in life or if they're having a hard time with addictions, and it just like explained what the counselor like side of it does, and like they use the DSM to help diagnose and stuff like that. And then the next one was family counseling, which I didn't really know much about, so reading this was interesting. And a family counselor, they're called an MCFT, which is marriage, couple, and family therapy. So that's more along like group therapy, but they also have certain sessions with just like the mom or the dad and the kids. And then the next article that I read was about play therapy. And basically play therapy is just, it's with younger kids, and you use toys and puzzles and stuff like that to help the kids kind of open up to you and actually talk, to get them in a more comfortable zone, so that they're not like, they don't feel like they're being like interviewed instead of just like talking about their life. And then the last actual like research article that I read was effective addiction treatment. And that basically just talked about how some practices use effective addiction treatment and some of them don't. And it's hard to tell where or what kind of treatment you're getting, so you need to go see more than one counselor to help your case so that you can be the most healthy. And then I went to 2 UNT classes, which was therapeutic play and child development. And in therapeutic play, that day we talked about the difference of letting the kid do what they can do versus doing everything for them. So for instance, if you let a kid pick out their outfit that day instead of you telling them that you're in charge, basically, instead of you saying, oh, you have to do this, it kind of like makes them fear you a little bit more, is what the teacher was talking about. So don't let a child not be able to do what they can do. And then child development, we talked about that day. The people in that class were doing a presentation over how the different upbringings of children affect them later on in life. So they talked about like 2 parents divorced, 2 parents together, deceased parents and living with grandparents, stuff like that. They did research on how that affects the kid growing up and how they will end up differently than another kid. So for my original work, I've decided that I'll come up with kind of like a fake client, and I'll work alongside my mentor to plan to get them like a recovery plan. And so like if they were dealing with depression or something like that, we would look to see the diagnosis of them, and then the same with like what kind of program we would put them on, whether it be in a workbook or just like talk therapy, and we would just kind of make that plan overall just to get them back on track. And then my mentor is Tara Wiedemeyer, and she is a licensed professional counselor intern, a licensed chemical dependency counselor intern, and a national certified counselor who works mainly with adolescent and adult populations. She received her master's in counseling and development from Texas Women's University and her Bachelor of Science from the University of North Texas. She She utilizes her knowledge and skills in order to help people achieve their goals, gain better balance, and overcome difficulties, thus facilitating cognitive, emotional, and behavioral growth. Ms. Wiedemeyer uses research-based approaches and is trained in relaxation therapy, expressive arts, addiction, play therapy, and chemical substance abuse dependency. She is committed to joining her clients on their journey to health and wholeness, and she is passionate about life and people and creates a warm, safe, and creative environment. And that's everything. I don't know how to...
It's 10:35, time-wise.
There was a document waiting, and so I had to run back and forth 3 times, and then the other person's thing